So we are the Family Center for Bipolar Disorder. We treat patients with bipolar disorder in the context of the family. Why do we do that? Bipolar disorder is a serious psychiatric illness that affects about 5% of the population. It has become more visible recently and more well known because in psychiatry we have developed new ways of understanding and treating the illness.
Bipolar disorder is a disorder of the mood. It involves cycles and ups and downs in mood, often very sharp, between mania and sometimes very profound depression.
It means that some people, sometimes will have fits of depression and feeling very down and not being able to go to work, not being able to get up, and then they go on to a period of where they're doing okay and they're at baseline and they're functioning and they can work, at their job and take care of their family.
The illness of bipolar disorder also has a profound effect on the family members who are around the person. They witness extreme changes in behavior. Sometimes it's very hard to understand why the person is locking themselves in their room one minute and they're just out on the town and being totally risky the next minute.
Right now, statistics are saying that around 1.6 of the school-age children are developing or develop some sort of bipolar disorder. It's interesting because 10 years ago was not something that was very common. What do we see? How do we see in these kids? We see manic presentation also. Very similar to adult in terms of grandiosity, but we have to be very clear that some of the symptoms are going to be overlapping with diagnoses like ADHD, anxiety disorders, or conduct disorders. So part of what is really important is to make the right diagnosis at the beginning.
We in the Family Center for Bipolar Disorder, we take and treat families. At the outset, people sign a consent that they're going to be treated as a family, and they'll have open communications about symptoms and about medications between themselves and with the doctor. We also provide the following services. We support the family if it is needed. Having somebody who is bipolar in the family is quite stressful and can strain the family relationships. And it's very important to make sure that the interactions in the family minimize negative emotions and maximize positive, constructive interactions in the family.
The way that we conduct our treatment, we start with 6 sessions that involve both the patient and the family members together. And the first few sessions are kind of teaching sessions. Basically, we have material about bipolar disorder, the symptoms, and how different ways to help prevent symptoms from getting worse, different risk factors and potentially ameliorating factors for the illness, information about medication. We try to make sure everyone, the patient and the family, kind of has as much information as they can have about the illness.
We teach communication skills. We also teach problem-solving skills. We try to help families anticipate difficult situations and plan in advance a good response for what to do when a crisis occurs.
You probably cannot even imagine right now treating cancer without family member knowing, or treating Alzheimer's disease without all the family members knowing, or treating diabetes or cardiovascular disease without family members knowing and helping the patient to get through it with support, medication treatment, and helping with diet and exercise. So this attitude is stigma-free and shame-free, and we believe that all psychiatry needs to be practiced this way. But in the Family Center, so far, we're one of the few and maybe the only program in the country who has this at the outset from the very beginning when the patient becomes ill. Care for the patient, care for the family.